The World Bank's Water and Sanitation Program estimates that 2.5 billion people live without basic sanitation, creating a deadly health hazard, especially for children. Nearly 1.5 million deaths a year are attributed to poor sanitation. Wambui Gichuri is with the Water and Sanitation Program in Africa. She says only 31% of Africans have access to a hygienic facility that separates waste from human contact. Our organization is trying to change that.
In Tanzania, we have a very specific target. It's just over 700,000 people are going to be covered under a project that's ending in November next year. This is happening in 10 districts, and the idea is to cover the rest of the country in a second phase. So the aspirations are big, and we're also hoping that in the second phase we can also cover a much larger area of Ethiopia, and we can cover other countries. We're present in 12 countries, and we also expect that the knowledge that we are creating in the countries that we are focusing on and the tools that we are creating out of this work can be used to scale up. In the past, initiatives had focused on delivering infrastructure, but the benefits will come out of using the improved sanitation facilities. So the focus now is on demand. Create the demand, let the house help to create the demand, let the household express it, and have a market that responds with supply of services and products. In other words, households are also investing in sanitation. And I think that even it shows that even poor households in Tanzania, we saw, for example, that the households that cannot come up immediately with the $4 to $5 to have the slab are finding a way to at least get a cover while waiting for the harvest so that they can be able to finance the slab.
Well, that's Wambui Gichuri. She is the regional team leader for the World Bank's Water and Sanitation Program in Africa.